Good afternoon, sir.
Good afternoon, Mr. Cascade.
Thank you. This afternoon, my first witness is Alan Inglis. I'll ask for him to be brought in.
Thank you.
Mr. Inglis, would you tell the inquiry your full name, please?
Alan Inglis.
And we are here to talk about your son, Callum.
Yes.
As I understand it, Callum was born on the 14th of November 1986.
Yeah, that's right, yeah.
And can you give me the date of his death?
I beg your pardon?
The date he died.
Yes, the 24th of October 2021.
I understand that you were previously married, but you're now divorced.
Yes.
And you have two children, one of whom was Callum,
yes,
and the other is your daughter.
Yes.
As you know, we're not naming your daughter or your ex-wife.
That's correct, yes.
The reason for pointing that out is simply that there was some contact between Callum and his mother
yes,
in the lead-up to his death. Tell me about Callum.
Callum liked the holiday. To achieve that, Callum would take on short-term working projects until he had enough money to put together for a holiday to Mexico, to Jamaica. He would have a blowout, and then he would come back and continue that cycle. Out with the holiday scene, Callum had a very close, tight network of friends who were all loyal to each other. And yeah, it was good to see that camaraderie when he would be out socialising.
I understand when Callum was young, he developed a health problem, or he was identified with a health problem.
Yes.
Can you tell us a little bit about that?
Yeah, when Callum was about 4 or 5 years old, he was diagnosed with asthma. It wasn't an occurrence that happened regularly. When it did, a doctor would be called, and he'd be prescribed a nebulizer, and the situation thereafter would be under control.
And was that something, many children develop asthma and then it goes as they get older. Did he maintain his asthma?
From memory, he would only have the occasional bout at that age 4. From that first bout, from age 4 and 5, I only remember another couple of bouts, and then it was in his early teens. Again, I remember a couple of incidents, and as far as I was aware, he had kind of outgrown that. However, later on in life, when I believe anxiety became more a part of his makeup.
Tell me about the anxiety. We'll come back to the asthma if we need to, but tell me about the anxiety.
I would have to say that I'm not sure when that began, and I'm not sure what caused it. But he would call me on occasion when he was troubled with it, and I would recommend that he went to his GP and seek some help. I also advised him on occasion just to sit down, rest, try some breathing exercises, whatever.
Do you know if he went to his GP about anxiety?
He did, yes. I don't know how often he went, but I do know that he did go to his GP, and I do know that he received medication for it, Yeah.
Would you regard yourself and Callum as having a close relationship?
Yes.
Right.
Yes.
But I understand in late 2019 you had a bit of a fallout.
Yes. Unfortunately, we did. And it was over. It was always what I would describe as silly stuff. So if Callum was struggling for a bit of money, he would phone his dad for a lump sum money, and I would help him out as far as I could. But when it got a bit repetitive, and I kind of stood my ground a bit, it was a classic case of throwing the toys at the pram, and so we wouldn't talk for a while, and then we would make up. And
I think there was a particular event after the fallout in late 2019 that resulted in you making up after that fallout.
Yes, it was. Yes, it would have been in January 2020. My dad had died suddenly, and I wanted Callum to know, because growing up, Callum and my dad were close, and I wanted Callum to be at the funeral, so I phoned Callum to let him know, and from then on, things were good between us.
Lockdown happened in March 2020, so not long after this.
That's right.
Did you communicate with Callum at that time when lockdown had happened?
Yes, it was mostly via a telephone call or texting.
But I understand in June 2020 you received the phone call, which you picked up and immediately recognised something about the phone call. Looking at 24.
Yeah. I would like to point out that I'm not hearing you very well. So.
Oh, I'm very sorry, sir.
No. I feel I should, because I'm kind of struggling a little bit to hear.
Right. Well, I'll do what I can to make that better.
Okay. It's okay.
My question related to paragraph 24.
Oh, yes.
And in June of that year, you received a phone call which you noted something about at the beginning of it.
Yes. So in June 2020, I can't recall the exact date, I received a phone call. When I answered the phone, I knew the call was from a prison, as there is a standard voicemail message played before the person calling speaks.
And was that call from Callum?
It was, yes.
And did he tell you what about him going to prison? Was he? I take it he was a prisoner at that stage.
Yes, he advised me that he was in HMP Edinburgh, Sogton Prison. He was on remand for 3 months until his scheduled trial was to take place. When the trial was heard, he was sentenced to 3 years imprisonment, of which he would serve 18 months.
Presumably, if it was from the Edinburgh area, he would go to Sogton. Presumably, he would initially be put into Sogton.
Yes.
Around about July or August 2021, he was transferred to a different prison.
Yes.
Which prison was that?
That was Adderwell Prison in West Lothian.
We don't need to know the circumstances in which the transfer took place.
Okay.
Did you visit Callum in Sogton?
I did. I went to visit Callum around about June. Let me see now. It was around about June 2021. Yeah, prior to his transfer to Adderwell. Yes.
And did he get you there? Did he get you there on a pretext?
I'm not sure I understand the question, sorry.
Sure. Did he get you there by saying something that you subsequently found out was not really true?
Yes, yeah, okay, thank you. Yes. His quote was, Dad, can you come in to visit me? Any chance you could bring me some money? I'm wasting away here. You only get, 2 meals a day kind of thing. So I took that with a pinch of salt, went to visit Callum, and he couldn't have looked any healthier. He had clearly been using the gym at Sugden. He had been clearly using the exercise yard, and he just looked fantastic. And it's a great, unfortunate last memory to have of Callum, because that was the last time I was to see him, and he looked fantastic. And I ribbed him about it. And
Sorry?
I ribbed him, I teased him about it, and we had a good laugh about him wasting away, but probably never looking better, So.
Right. Addywell. Did you see him in Addywell?
In Addywell, I had been on, after the transfer to Addywell, I had only spoken to Callum over the phone or via text, and he had been in there a couple of months, and I had asked him about going in to visit him, and he said, just leave it, Dad. It's like a jungle in here. I'd rather you didn't. I'm getting out soon anyway. And so I just trusted his judgment on that,
Okay. So. I want to ask you about paragraph 35 and the contact that you had with Callum after your visit to him in Sogden.
Yeah, after that visit, we kept in touch either via using the standard prison phone or a shared mobile phone he had access to whilst in prison.
That was an illicit phone?
Yes.
Sorry, give me a second. Whilst he was in prison, did he undertake any educational courses?
He did. I know that he completed a food hygiene course for which he received a certificate. And I know that, so this was prior to testing positive for COVID. He had worked through a food hygiene course. His mum and I were delighted about this and made a point of praising him. He'd said that there was a possibility of him picking up some part-time work after his release from Addywell.
Without naming the person, did Callum build up a positive relationship with one of the prison officers?
With one of the prison officers? Yes. Yes.
And whilst he was in Addywell, did he receive any medical assessments?
Yeah, he did. Yeah.
Can you tell me?
I found out after Callum had passed that he'd had an NHS review with a nurse for his asthma after struggling with his breathing. This was the 12th of October 2021. This was about 2 days before being tested positive for COVID on the 14th of October.
Right, so he was tested on the, he was seen by a health professional on the 12th, and then he got a positive result on the 14th.
Yes.
So that would have been a test taken probably during the examination.
I'm not sure about that. All I know is that he was struggling with his breathing, had an asthma review, and his inhaler dosage was increased at this time.
He got his positive COVID result on
Yeah.
the 14th.
Yes.
How was that communicated to him?
It was from the text exchanges that his mum and I received. It was communicated to him just through his cell door.
Sorry?
It was communicated to him through his cell door by one of the prison officers.
So, and was he given any medical advice about what he should do at that stage?
I know he wasn't given any advice. The initial symptoms he had were, in addition to difficulty in breathing, was headaches, and they had asked for paracetamol, but he was told they didn't have any, so he didn't receive any.
You understand that his condition deteriorated.
Yes.
What was the the clearest sign that something was seriously wrong?
4 days before Callum, 4 days before Callum died, he began to cough up blood. He was shouting this to the prison officers through the cell intercom, and he was told someone would come to see him the next morning on each of those 4 days, but nobody ever did.
And how did you find out that information?
From the texts that Callum was sending his mum and I.
So far as you're aware, did anyone medical come to see him?
No one at all, no.
No one. Was he in a shared cell or a cell on his own?
No, he was in a cell on his own. Yeah.
Could I ask you, sir, to read aloud paragraph 62?
Okay. Callum had texted to say that despite telling the staff about his symptoms, all he was given for pain relief was paracetamol. The paracetamol was passed under his cell door by a prison guard. He did not see a medical member of staff.
And then if you just carry on, please.
He said the paracetamol was not even touching the pain. In a text to me, he said, "I'm in a bad way, like."
And at 65, you know that he was also texting his mum.
Yes, she was also aware.
Right. You gave him some advice in a text message which you record at 64.
Yeah, I had advised Callum not to leave it too late, and that they may need to call an ambulance for him. He never confirmed if he had requested one.
At 67, you talk about a text that you received from Callum.
Yeah.
Can you read that?
So this was this was a text I sent Callum on the Friday the 22nd of October. It was the last text I was to send him. So I asked how he was, and he said, I asked how he was and said that I was thinking about him. He replied saying, "Bloody awful, Dad. I just can't shake this off at all."
Drink of water. I just can't shake this off at all. This has by far been the worst 2 weeks of my life. The most horrible feeling.
Yeah, I said words to the effect that he must get seen by medical staff soon. I genuinely thought it would just be a matter of time before the prison staff would see how ill Callum was and get him the help he needed. I trusted that he was in safe hands. I trusted that he was in safe hands. And that's something that just haunts me. I just feel so foolish.
You then talk about Sunday the 24th, at paragraph 70.
Yeah. So about 4:30 p.m. on Sunday the 24th of October, I received a text from a friend of Callum's, someone who had met on several occasions, asking me to call him at home. And I kind of had a gut feeling, given what had been going on beforehand, that I was about to receive the worst news of my life.
Was this person someone that you believed would be able to get information from inside the prison?
Sorry, could you repeat?
Yeah. Was this person someone who you thought would be able to obtain information from inside the prison?
What I can say is that he heard by word of mouth, through word of mouth, that initiated from the prison to outside and then was doing the rounds. It got to him and he thought, I need to get in touch with Callum's dad, which he did. So he asked me to call him and I did.
And what was the
that caused a huge amount of distress for us all, but particularly his
For
mum.
your wife and daughter?
Yes, yeah, particularly Callum's mum and sister, as they had not seen him since my dad's funeral in January 2020. However, because the local mortuary was full, Callum was transferred to Edinburgh, who were operating under different COVID guidelines. This meant we could view Callum, albeit behind a glass panel.
Was the opportunity to view Callum something that was important to you?
Absolutely. Given the nature of Callum's death, where to this day, and I'm speaking for his mum and sister as well, we're racked with guilt that we didn't do anything. We have the text messages to prove how his health was deteriorating right up until his death, and I just feel a complete fool for trusting that he was in a place that he would be looked after, and he was let down badly. And I just can't forgive myself for not calling an ambulance myself, for not even calling the prison. And I know people will say to me it wasn't my job to do that, but I was his dad.
Paragraph 102, you say that Callum was laid to rest on the 12th of November 2021, 2 days before his 35th birthday. Were there restrictions on those who could attend the funeral?
Yeah. At that time, I'm aware that restrictions were being lifted, but there was still a limit, and so we were restricted to 40 people, which I know at that time was really good compared to what other people have enjoyed. And from a very selfish point of view, I don't think I could have coped with many more people than that.
We've obviously seen physical evidence about the impact of Callum's death on you. Could you tell us a bit more about the impact on you?
So, the impact of Callum's lack of care and treatment in H&P Adderwell is that he received no care after he tested positive for COVID. What processes were in place for prisoners that tested for COVID? What about those who are not vaccinated and had asthma? Why was Callum not taken to hospital? I don't think the prison knew what they were doing. Even if the situation had become unrecoverable, having Callum removed to hospital would have meant that possibly his mum, sister and I could have been by his side when he died. The fact that he died alone, despite clearly requesting help, that's an issue that needs major investigation. Callum had asthma and COVID. Why did this not raise concerns? My daughter, who is a qualified nurse, always says you can tell how bad someone is from eyeballing them. Why did no medical person take the time to physically look at him? And then why were we not informed about his passing sooner than we did?
Can we move on to paragraph 119? I'm not trying to get you to miss the other paragraphs out. Lord Brailsford will read them all. But paragraph 119.
Yeah. for the first couple of weeks after Callum passed, I was contacting my daughter daily to find out where she was and if she was okay. I had become paranoid about losing another child. I spent a lot of time in bed, often until the afternoon, and not eating properly for about 6 months or so after my son's death. This impacted massively on my ability to work, which led to financial challenges. Emotionally, physically, and financially, I have been affected, and still am.
Now, you talk about the impact also very briefly at paragraph 123 on your daughter and your ex-wife. You say there, we are all supporting one another.
Yeah.
Can you tell us about that?
Well, I've kind of described, how it's impacted me, but when Callum's mum and I, or Callum's sister and I would be together, it's then dealing and seeing their grief and feeling the grief, which just compounds your own. And speaking for them both, I can see that they've both, Callum's mum and sister, have, developed an anxiety about the way he died. They're both nurses. They've both read the post-mortem report. I haven't, but I know it must read like a horror story. I know they have nightmares about him being alone and being ignored in his final hours. They have both received medication to deal with that anxiety, and they need that to maintain their ability, using my daughters as an example, to maintain the function to be a mum, a wife, to be able to go to work. And then my daughter hadn't spoken to her brother for some time, and I know she's racked with guilt about having that reconciliation to make up with him. That's been taken away from her, and this is continuous.
You talk about lessons learned at the end of your witness statement, paragraph 124, and you say you want to ensure that this doesn't happen again.
Yeah. From day one, Callum's mum, sister and I have said the outcome of this inquiry needs to result in a process where this cannot happen again. If it prevents one family from going through what we are, it will be a positive result.
Sir, those are all the questions I wish to ask you. Hopefully, you've had the opportunity to say everything that you want to say. Is there anything else that you need to say that you've not said?
I guess, in a way, I often say that when talking about Callum's death to family and friends, and maybe not getting the response that I was looking for, and I know that's maybe being selfish, but and I'll say, yeah, people don't get it. I'll say people don't get it, but I actually don't want people to get it. I don't want there to be any other families
that understand.
Sitting here, So, we just need to get to the truth with what happened, not just in my case, but for all the families that were affected by COVID.
Thank you very much.
Okay.
Yes, thank you very much, Mr. Inglis. That's all.
Okay, thank you.
Right, Mr. Caskey.
10 past, sir, if that's okay.
Yeah, I was going to say course pass. But
All right,
10 past is fine.
quarter past would be better.
Would it? All right, course
Yes.
past it is then.
Thank
Very
you.
good. Thank you.
Hello, sir.
Good afternoon, Mr. Kasky.
I have a witness for you this afternoon, a Mrs. Bartlett. I'll just ask for her to be brought in.
Please, thank you.
Please have a seat. Would you tell the inquiry your full name, please?
Yes, it's Jacqueline Bartlett.
And we have all of your contact details, and we also have a detailed witness statement from you. I'm going to start unusually at paragraphs 2 and 3 of the witness statement. Could you tell us a bit about your own professional experience?
I'm a registered nurse since I started as a registered nurse in 1988. Worked in medicine for the elderly, assessment and rehab for most of those years. Firstly at Bereaved Hospital, moving to the Larkfield unit in Inverclyde, where I was a senior staff nurse for years. I went back to university and did a conversion course, it was called, and then I went on and done a degree in gerontology with interprofessional working. And then I moved to Glasgow, hospital falls coordinator role, and within the same health board. So I'd worked with Greater Glasgow and Clyde for 34 years before moving to Ayrshire and Arran 2.5 years ago to do a similar role, set up an inpatient falls service and work within the quality improvement team. I'm a dementia champion. I went on and started my masters in gerontology with dementia. I did my first year, passed my first year, and then the pandemic hit and I just didn't go back. I work as a independent nurse advisor with the Scottish Ombudsman, and I've done that for the last 6 years. And that's
so you're very experienced in this field?
Well, I'd say I've had a very busy nursing career. Yeah.
Okay, we're here today to talk about your father, and he's one of the people that we can't name.
Yeah.
So we'll just refer to him as your father.
Yeah.
I understand that your father was born on the 9th of December 1947 and sadly died on the 22nd of November 2020.
Yeah.
I know that he had some strokes and so on later in his life, but tell me about your dad.
So my dad was very much a West of Scotland man. He was an engineer. He worked in shipbuilding and various engineering companies throughout his career. In his younger days, he was in the pipe band. He was a youth football referee. He volunteered at local youth clubs, and he was an active member of his social club, which he enjoyed. He's quite a quiet man, very reserved, quite a proud man. He would have hated the way he ended up, and that was him.
Do you have any siblings?
I have one brother.
Again, please don't name him, and also don't name your mother. I understand from the witness statement that your mum and dad didn't live together towards the end of your father's life. Can you tell us about that?
Yeah, well, Mum had started up a drug rehab unit years ago, and she moved away to set that up, and that's what she did for many years. They remained married. They just didn't live together for about 20 years. They still owned the house together, and as Dad's illness has progressed and he became frailer, we all became his power of attorney. So Mum always dealt with his financial and his welfare side of things, so she was very much involved.
When Mum moved out, as it were, did anyone else move in to live with him?
Not initially, no. My dad lived himself for years until he had his strokes in his 60s, and my brother was the person that would come in and check he was okay. But as he deteriorated, we had to get social work involvement and carers at home for him.
So carers were going in to assist your father. How often would they go in and for how long?
So initially when he had his strokes, he was able to live himself. He had some visual impairment and mobility impairment, but with my brother going in and out and with us supporting him, Dad could manage at home. As the years progressed in his cognition, he ended up getting a diagnosis of mixed dementia, vascular and Alzheimer's, and also he had other health conditions. He became frailer, so his mobility was affected, and then we had to get care in initially twice a day, increasing it up to 4 times a day, so he had a full package of care. He had 2 carers in the morning for his personal care, getting him a shower, getting him up, getting his breakfast, medication. They come in at lunch, personal care, medication, lunch, evening meal, and then tuck in at night where they were putting him into bed and getting him settled. And
was that provided by the local authority?
It was through I think it was arranged through them. I don't know if I can name them or not, but they were very good.
So the care package that was in place was a positive thing for your father and for the family, and you regarded that care as good? Yeah, they were very good. There was carers that were consistent, and Dad related to them okay. There was a lot of older men that he related well to, and then even the younger ones that came in, they knew him well, and it was fine. You talk at paragraph 12 about a blood condition that he developed. Can you tell us about that in terms of its impact on your dad? He was diagnosed with essential thrombocythemia. That's a chronic blood cancer affecting mostly your clotting. It didn't really affect him much. We took him up to the haematology unit for appointments. He got chemotherapy tablets Monday to Friday, which my brother would administer. But really it was a chronic condition. It didn't have a huge impact on him. At paragraph 13, you describe your father's condition as deteriorating, but he always knew who you were. Yeah. Well, he knew the family, he knew everyone. He had 3 grandchildren, and at that point 4 great-grandchildren who all knew and recognised. Even though his dementia was progressing, his use of language, he couldn't say many words at that point, but he still enjoyed the family come in. We believe he recognises right up to the end. There was never anything to suggest he didn't. And when lockdown happened, where were you working at that time? I was working in the Queen Elizabeth. Doing what? Inpatient falls. And then when lockdown happened and the pandemic hit, did that change? Yeah, so there was 5 of us in our team working across Greater Glasgow and Clyde doing the specialist role. So it was agreed, because we couldn't do all elements of our work. We couldn't do education anymore because things were, it was down to essential services at that point. So we agreed that 3 of the team would be redeployed and 2 of the team would stay and continue the workload that was remaining. I went to Inverclyde Royal at that point, and what I was to do was to go the front door at Inverclyde Royal. So it was a new service that was being set up just to really organise the footfall of people coming in and out. So that's where I went. And did the family arrangement change? Did your brother do something significant at that time? Yeah, well, we discussed obviously that everything was shutting down at that point, and we didn't want carers coming in to Dad with him being so vulnerable. He needed full care, but we couldn't risk for maybe 8 or 10 people coming in the house, going to different houses. So my brother says why he agreed, I mean, very selfless, to move in with Dad full time and just to cancel the carers. Myself working in healthcare, my partner worked in healthcare, so we were still having to go to work. So it was agreed that my brother would move in, we would deliver him lots of goodies and just come up and wave through the window, and that was agreed. So we cancelled the carers at that point, and then my brother moved in full time. And as time went on, did your brother find that difficult, challenging?
Yeah, because, I mean, Dad couldn't walk. He needed a steady for transfers. He had a catheter. He was vulnerable. He had lots of different needs. And obviously, my brother was locked in a house, basically, with somebody fully dependent on him without a break. So as time went on, things started to lighten up a wee bit in society. People were starting to move about a bit freely, and that's when we had to think about getting carers back in, because my brother was exhausted, understandably.
At that point, did you think about respite care?
Yeah, we did. Initially, we started the carers back twice a day, so they started coming in morning and night to help with the heavy workload, the showering and the bedding down at night. And then we discussed respite care, whether we could maybe arrange for Dad to get into respite for a long weekend, just to give a full break.
And was that possible? Was it possible for him to go in?
Yeah, we had a really good social worker, and he had arranged as a respite care before, so he'd went into respite, and it was successful. Dad was not distressed, and he was well looked after, and we thought we could maybe try that again. But unfortunately, the place didn't reopen after the initial lockdown, and the next suggestion was nursing home.
Mm-hmm. Was an assessment carried out before he went anywhere?
Yeah.
Tell me about that.
So the nursing home we'd agreed to, I'd previously worked with the manager and very much respected her as a nurse, and I thought it would be a good place to be. So the deputy manager came up to the house and did an assessment on Dad's needs. My mum and my brother were there. I wasn't there at that point.
You talk at paragraph 25 about a document produced by Alzheimer's Scotland.
Yes.
Titled Getting to Know Me. Mm-hmm. Can you tell us what that is?
Well, I suppose it's a document that's produced to help people understand the person who has a diagnosis of dementia, so you know about their life, their needs, their likes, their dislikes, their family, their background, and how they manage with all their activities of daily living. They're very useful within hospitals for understanding people who come in with dementia. And it gives you something to have conversations with. Oh, you were an engineer, or your daughter's this, your son, you've got a family. So I had completed a full getting to know me for Dad prior to getting into the nursing home. And
does that also contain details about his medical conditions?
Yeah, everything.
Normally, if it was being completed by a layperson such as myself, that would just outline the nature of his obvious problems. On that form, did you identify anything specific about your dad's breathing?
Yes. I said that Dad had been a smoker for many years, and he coughed. He coughed all the time. I mean, that was just what he did. He took his time eating his meals because his swallowing was getting delayed and slower with his progression of dementia. So we used to cut up his food. He had softer portions, but he would cough, and that would be not unusual. We wouldn't worry about that.
But that was identified on the form?
Yeah.
How did he physically get to the care home?
Mum had purchased previously a car. It was a wheelchair accessible car, so we did have that. We could take Dad out in that anyway, so he had a wheelchair and we had the car, so Mum and I took him up in the car to the nursing home.
And then what happened on arrival?
Well, on arrival, we couldn't get through the door and they wouldn't let us in. They said that the nursing home had been locked down because a staff member had tested positive, and we couldn't get him through the door.
And so they weren't going to let him in?
They weren't letting him in. They weren't letting us in to take him in and get him settled. Right. So he could come in, but we couldn't.
And how did you react to that suggestion?
Well, the first thing we said was, well, you don't know him, you don't know what he needs. But we were reassured that a good assessment had been carried out prior to coming up there. we'd also been told that we could visit while he was in. We could have 3 family members from 2 different households. There was a special place to visit. I said, what about visiting? Oh, he can't visit. And I said, well, we're told there's a special place. And that was one of the reasons that we were reassured that we would place him in the nursing home. We asked to speak to the deputy manager, and he came out, and this was the same person who'd done the assessment at home. It was denied that there was any visiting mentioned, and also saying that he would have to isolate for 2 weeks in his room. We were thinking,
Had you been forewarned about that?
no,
No.
no.
Now, whilst you were at the front door, what was going on around you?
Well, there was a lot of staff about. Some staff were going past us, going in and out the unit.
Were they wearing PPE?
They had masks on that I could remember, yeah. That was all I can remember at that point.
Did you know what they were going out for?
Well, at one point, at the next time when we came up to visit, staff were visibly going out for cigarettes, and there was a point where we saw several staff members sitting in a car smoking.
Were you in so you take your dad up, they say, you're not coming in, but we'll take him in. Are you then in touch with the care home to find out what's going on?
Yeah, well, we had, before we left him, we asked for somebody, one of the nurses, to come from the unit he was going to be placed in to have a discussion with them. It was one of the nursing assistants that came down, and he says it would be fine. And I says, look, he can't walk, he needs a steady. Please don't try and make him walk. I've put a getting to know me, it tells you everything about him. We had all his medications, we had foods that he liked to eat. So that was before he left us, and we went away thinking, oh, is that the right thing to do? You know, it haunts us to this day that we actually left him. But we phoned every day. So that night, obviously, we phoned how's he been. He was settled. And for the first couple of days, he seemed to be fine. He's up sitting, he's settled, he's ate all his meals. And that was fine, we were okay. But we were phoning every day, twice a day, just to see how he was.
And on the third day?
So on the third day, that's when things changed. We phoned up, Dad had a coughing episode, which we said was absolutely normal. We were told that he had to be suctioned, so they had to put a suction catheter down his throat. They were worried that he had aspirated. And I'm saying, Dad coughs, he takes a softer diet, he needs to be up sitting, and I was concerned at that point. I thought, he's in for respite, he's come in medically stable. 3 days later, you're putting a suction down his throat, and I was not happy.
Hello again, sir. Sorry about that. I was asking you about much later on when you spoke to a nurse who had carried out the suction catheter. Can you tell me about that conversation?
I think it was, I suppose, played down a couple of days after Dad went into hospital. We'd asked to go up and speak to the manager, and the nurse was there. I was just looking for reassurance of what kind of tubing they had used, because Dad's mouth was in a terrible mess. When he got into hospital, he couldn't swallow, his tongue was swollen. And the nurse basically says, oh, he just put the tube in and out. It was a fine bore tube and it just in and out. So.
And were you satisfied with that?
No, I wasn't satisfied at all. I think what dissatisfied me most, they had called the GP practice and spoke to the nurse practitioner. I later got hold of those notes of conversations, got hold of Dad's notes from the nursing home, his observation charts, everything was fine, his observations were fine. I felt it didn't require treatment, it was a normal cough for him. I felt as if he was unwell at that point. He should have been seen by a GP, he should have been taken to hospital. He could have had his bloods checked to see if there were signs of infection, but he was prescribed a large amoxicillin 500, an antibiotic, without being seen by any practitioner.
Do you know who wrote the prescription?
Nurse practitioner.
Right.
Mm-hmm. Yeah, and I did question them about this afterwards. They says they took the words from the nurses that he needed an antibiotic to cover for a chest infection.
Can I ask you, do you know what the pills physically look like?
Yeah, it's quite a large capsule to swallow, yeah.
Right, and did your dad have difficulty swallowing?
He did. I mean, he had a softer diet, he had a delayed swallow, he wasn't on a lot of tablets. The ones he did, they were quite small, he managed to take with fluids. But I don't think he actually really swallowed them, because he had a terrible sore mouth. His tongue was swollen to twice the size when we managed to get hold of him again and see him again. So we believe that they were probably lying in his mouth, maybe melted there, causing irritation in his mouth. So I don't know. I mean, we were also told by one of the nurses they had to put their fingers in his mouth to get foods out from the back of his throat. And these things were all within the first few days of being in respite, which really distressed us. So much so that we went up to try and get in.
Uh-huh.
So on the 5th day, you know, the conversation the night before with the nurse in charge of the dementia unit had said that Dad was lying in a frog-like position. Was this normal? And we were saying no. And we were really concerned. We were saying, look, this is not him. I'm going to come up tomorrow and I want to do a welfare check. We want to come in and check he's okay. Can my brother and I come up? And we were told, you can't come in, the place is shut. But we went up. And
did you explain your background?
Mm-hmm, yeah.
And did you speak to people there?
We went up the next morning, my brother and myself. So we went up and we spoke to the nurse in charge of the dementia unit, and also the nurse who had done the suction tubing. They were at the door.
And were they wearing PPE?
They had masks on that I could see, yeah.
Right.
We weren't allowed in, we were kept through a crack in the door. And
did you indicate that you were a working nurse, as it were, and presumably, therefore, they would know you knew about PPE?
Yes, I mean, I says anybody could walk in. I mean, the maintenance man walked past us as we were standing there going into the unit, which was staff were going out for cigarettes as we were standing at the door trying to get in, pleading. I says, we'll put on a mask, you know, we'll clean my hands, we'll do the same as you. I just want to walk into that room and see that he is okay, because he didn't sound it. He was deteriorating and we could tell, because he went in for respite, but at day 5, and he sounded to me as if he was very unwell.
At paragraph 40, You say a question was asked of you that caused you concern.
At that door, we were asked, did we think Dad had dementia? Which was unbelievable, since he was in a dementia unit, and it was pretty evident. We had got Dad a mental health assessment a few weeks before that from the older people's mental health team came out, and it was to do with his care at home, and we just wanted to get an updated assessment. And the mini mental test they did is out of 30 points, and Dad got 1, and that was only because he guessed the day of the week, and that was just, and we were laughing because he said it was Thursday, and it was a Thursday, and that was, so he had no capacity, you know, and it was just another blow.
Yeah, even a stopwatch is correct twice a day.
Yes.
Yeah. Paragraph 44, you take a fairly significant decision in relation to your dad. Tell us about that.
So Dad was to be in the nursing home for a 2-week period. So it got to day 7, and it was just, we were just too distressed. We knew that we couldn't get in to see him. We'd tried to get in. We'd been up at the door, and Mum and my brother took the car up and told him to get him ready. They were taking him out. So Mum and my brother drove up to the nursing home. Dad was sitting in his wheelchair waiting, and took him home. I was driving down from work that day, and met at the house. They'd already lifted him into his bed. He was so, oh my goodness, he was dying. He was so ill. Mum had phoned a speech therapist because he couldn't swallow anything. She'd phoned his district nurse, who knew him really well. He had pressure damage as well on his bottom.
I'll ask you about the district nurse in a second, but you said he was dying.
In my opinion,
were you saying that in your professional capacity as a nurse?
Yes, he was dying. If he'd been in there for another few days, I believe he would not have survived. Okay,
you talk about the district nurse. Tell me about that. How did that come about?
When Mum got him home, he had a hospital bed in the house. He had a pressure relieving mattress. He had everything he needed at home. So they put him into bed, and he was just so flat. He was delirious. He was in pain. He was frightened. Mum phoned.
What was he in pain from?
Well, for some reason, his hip, he was lying with his left hip externally rotated, so the leg was lying to its side. And we thought, has he had a fall, or is it dislocated? What is wrong with this hip? Because every time we touched him, he was in pain. Latterly, he got an X-ray, and there was nothing to show on it, but it was probably because he was so deconditioned and so unwell, he was lying in that position. So Mum had phoned the district nurse, who came right up.
Did she know him?
Oh, she knew him well, and she was very upset when she says, and what have they done? You know, what have they done to him? And she checked, and he had a pressure damage to his bottom. She didn't have any breaks in his skin when he went in, so she put a dressing on that. Mum had phoned the GP because we were so concerned about him. I took pictures that day, and they're haunting. And the GP came up right away. The speech therapist gave some advice over the phone, but at that point the GP had come up literally within a couple of hours, and he'd arranged an ambulance to get him straight to the hospital.
Did he arrange that before or after he saw your dad?
After he came up pretty quick. Within 4 hours, the dad had been home. He was in an ambulance going to the hospital.
Paragraph 50. Can I just check, is this the hospital that we're talking about? Is this the hospital you work at? No.
This is the one I was redeployed to. Can I mention the hospital? No.
I think you can.
Yeah.
Yes.
So it was in Inverclyde Royal, so that's our local hospital. So it's the one nearest to our home. Although I worked in the Queen Elizabeth, I had been redeployed to the front door, but that was for a 4-month period at the start of the pandemic. One of the roles I had at the front door was footfall, you know, getting people in and out. There was essential visitor guidance that was issued to staff or that I remembered, and I knew about essential visiting, and I had phoned ahead the hospital before when Dad was in the ambulance and just said to the staff, I spoke to them in the accident emergency, Dad's essential visitor, when he comes in, he's got a diagnosis of dementia.
So he gets taken up to the hospital in an ambulance, and you go up and you can access him?
Yeah, I was with him the whole time in hospital.
Right. Presumably, if he's arriving in the circumstances that you describe, he goes into A&E. And what happens at A&E?
Well, I was with him, and the doctor came in and gave him a really good, thorough examination. He had oxygen started. They took his bloods. He went for chest X-ray. He also went for a hip X-ray. He was started on IV fluids. He had severe acute kidney injury at that point. His inflammatory markers were high. His chest X-ray was clear for some reason, but they started him on IV antibiotics as well. He was nil orally because he couldn't swallow, and he was referred to...
Just hang on a second, we've lost Lord Brailsford.
I can hear you and I can see you.
You can see us?
I can see you and I can hear you.
I'm very sorry you can see me, but are you content for us to continue, my lord?
I think so. If you're prepared to believe that I can hear you and see you.
Well, you're certainly able to communicate with me.
Yeah.
Yeah?
Yeah.
Okay. Can you tell me how your dad appeared in himself? You've spoken a lot about medical conditions, but as well as being a highly qualified, experienced nurse, you're also a daughter. Tell me how he was.
Oh, he just looked frail. He looked terrified. He was scared. He had a delirium, so he was quite hypoactive as well. He was really flat. Just kind of looking about the room, that was all he was really doing then. So they checked his mouth as well, and his tongue was just so swollen, so he couldn't really communicate, he couldn't take a drink, and it cuts at the back of his throat as well once he was assessed with the speech therapist, but he never ever swallowed again after that.
Do you know, are you able to speculate, or do you know what caused the scratches at the back of his throat? No. I mean, the speech therapy had done a really good assessment. In fact, they followed him all the way through his hospital journey. They were really, really good. Although with people with dementia, their swallowing can, be affected to the point where they don't swallow. It was just such a rapid stop. I believe that it was because his tongue was so swollen, his mouth was raw. No, I don't know what caused it. I wondered if it was the antibiotics that had maybe been on his tongue. We'd also agreed that he would get a CT brain to see if he'd had another stroke or anything, which was negative. So, no. At paragraph 53, you talk about initiating a conversation regarding DNAR. Can you tell us about that, what that process was for you?
Yeah, so when they were finished all the initial assessments in accident emergency, they said he was to be admitted, so he was going up to the receiving ward, and again I was able to go with him. The nurse was really good. When we came in, Dad got settled. I was able to write out another getting to know me document and help with his admission. The doctor came in and saw him, and it was myself. I'd phoned my mum and my brother, and I says, look, they're going to mention DNAR, so let's have a chat now. I says, in the unlikely event that Dad has a cardiac arrest, he will not survive, and really, let's decide now. So we decided to initiate that conversation. So I spoke to the doctor. I mean, she agreed with me that it would be futile if Dad did have a cardiac arrest. So a DNR was put in place at that point, and that was the thorough agreement.
Paragraph 54, you talk about, you obviously had been in with your dad up until that point, but you talk about a change there.
Yeah, so he was in the receiving ward for about 24 hours, and then he was moving down to the medical ward. And I just said that Mum we spoke between myself, and Mum says, you know, because I was still working, and Mum would just go in as an essential visitor and just said that she'd come up every day and visit, and nobody ever challenged that. That was accepted, and that's what Mum did the whole way through. So she would FaceTime every day when she was up as he was slowly recovering.
You talk about testing for COVID at 55. Yeah. Tell us about that.
So I think the rules at the time within the health board, there was that anyone over the age of 65 was getting a COVID test on admission, and then every 4 days throughout their admission to a hospital, 3 or 4 days, I can't remember what it was. So he'd had COVID tests in the hospital which were negative.
At 56, you talk about essentially he seems to be getting a little better.
Yeah, I mean, his kidney function had went back to normal again. He was brighter. He still wasn't swallowing. They tried a nasogastric tube with a speech therapist, and that worked for a few days till Dad swiped it out. Oxygen was off all that again, and the physios were in just working with him, mostly in bed, because they still couldn't get him to maintain his sitting balance after that. So they were just working and while he was in bed to keep his muscles moving.
Now, the room that he was put in, tell us about that.
So it was a 4-bedded room. There was other men in the room. That could have changed throughout the time, but when Mum was going up, it was a 4-bedded room he was in the whole time.
Did anyone show any symptoms of COVID whilst he was in there?
Yeah, so he'd been in there for maybe almost 2 weeks at that point, and there was a gentleman in the next bed who was symptomatic, coughing, spluttering, oxygen on, which did raise some concerns with Mum at the time, because she did comment when she came home, oh my goodness, the man in the next bed was really sick.
Did you find out why he was in a shared room later? Yeah,
I mean, we did put in a complaint to the health board, just not about care and treatment. Treatment was great, I can't complain about anything, but really just about COVID itself, and saying that Dad had been on the shielding list, but that had been stopped, I think, the August, September, so this was now October, and that the health board said that they just didn't have enough single rooms to accommodate people who were frailer, which, and that's understandable, so they can't do it for everyone.
You talk at 58 about the possibility of him moving on into another care unit.
Yeah.
Why would that be?
Well, the Larkfield unit's connected to Inverclyde Royal, so that's an assessment and rehab unit for older people, and it gives time people for slow rehabilitation. So it was really, Dad was probably going to be in for a while until he was able to eat and drink again and get up and moving. So the Larkfield unit is a place he would be referred to. Right,
and on the 18th of November something happened that prevented that.
Yeah.
What was that?
So I'd get a phone call that day from one of the nurses to say that Mum couldn't visit any longer as Dad had tested positive for COVID.
And what was your reaction to that?
Oh, we were pretty shocked at that point. We're thinking, oh, he's come through all this, he's getting medically stable, we're thinking about moving forward, and now he's got COVID, and he's obviously got COVID in hospital.
Did you get the information that he had tested positive, as it were, through formal mechanisms, like someone speaking to your mum?
No, it was a phone call to me, which was fine. We were both down as next of kin, but it was really just to say that I suppose what bothered me a wee bit, they didn't say it was hospital-acquired COVID. It was your dad's got COVID and no more visiting. It was really, I would have expected maybe something about, and I mean, the health board said that, you know, we should have had a discussion, because Mum had been up visiting the day before, so really just for her to go and get a test and take precautions.
She wasn't told to go and get a test?
No. Well, I'd arranged one anyway, so she went and she was fine.
A few days later, you get a phone call from your dad's consultant. Tell me about that.
So the consultant had phoned, and really just to say that Dad was dying. You know, he was going to have to get into a side room, and really that the COVID was the last thing he needed. You know, he'd been progressing okay, and that I could come up, or we could come up and be with him, because he was now at end-of-life care.
And did you?
Mm-hmm. So it was agreed again that I would be the person that would go up this time. So I went up and just sat with Dad, and sat with him for about 10 hours. PPE was provided, you know, outside the room. I had a full gown, I had a visor, I had gloves, I had everything I needed. And I just sat with Dad. He was unresponsive, but he was fairly comfortable. Ironically, I went home to get a shower because I thought he was quite stable, and then I got a phone call saying he had passed away. So I didn't back up after that.
Right. Did you get the death certificate?
No, we got told we would get the death certificate the next day, but when I went up to get it, it had been reported to Procurator Fiscal. So, do
you know why it was reported to the Fiscal?
Yeah, I do. The hospital or the board had made a decision to report any hospital-acquired COVIDs or COVIDs to the Procurator Fiscal. And I spoke to Mum, and I says, we'll expect a phone call from the police. They will ask you questions, and then latterly the death certificate was emailed to us.
You provide very brief details in relation to the funeral, but you indicate that you basically, it was the same for everyone at that time. Nothing particularly bad in your
No, Dad had already paid for his own funeral. Mum had arranged all that anyway, so it was seamless within the event. It was just a case of it was getting organised. There was only 20 people allowed, which was actually probably what he would have liked. It was quiet, and then all the family went away and we had a nice breakfast, and then that was it. So we were quite happy with that.
At paragraph 67, you indicate that you had made a complaint.
Yeah, several.
Tell me about that and the response.
Do you want the nursing home complaint first?
No, not yet.
Right, okay. So the complaint to the hospital was not about Cairn treatment, and I have to stress that because Cairn treatment was good. He was treated well and he was given every chance, but all the nurses, the AHPs, speech therapists, physios, consultants, it was just about the fact that he got COVID in hospital. You know, there was a symptomatic patient in the next bed. I think it was about Mum not getting a phone call for, you know, giving her, this is hospital acquired and this is a process with the Procurator Fiscal, etc. And really advice for herself. So that was what that was about.
You say at the paragraph 67, you got some kind of response from the hospital.
Yeah, we got a response. Obviously, there was a symptomatic patient, but they can't reveal other patients' medical. So they just said that COVID was acquired in hospital, and that was the first we got it in paper that it was hospital acquired. Because I wasn't sure of the rules. You know, you had to be in for so many days before it was classed as hospital acquired. There was also a staff outbreak. There was an outbreak in the ward. The ward was closed, and staff members had also tested positive. And that was one of our questions. Well, how many staff were tested positive? But we never get any answer to that.
Could you read paragraph 67 aloud?
Yeah. When I made the complaint, the consultant said that some of the staff let their guard down a little in the second wave. The care was good, consultants excellent, speech and language therapists, physios were fantastic. Dad had the best shot he could have had while in hospital. It was a neglect from the nursing home that I was most unhappy about.
And tell us about that, please.
So we did put in a complaint. Mum put in all the complaints for all these areas. And there was 9 heads of complaints, and starting from the assessment at home, which was, when I get hold of that assessment later, it was not the standard of it expected. They didn't use the getting to know me. They didn't let us in. Essential visiting, skin breakdown, deteriorating patient. They didn't get him escalated where he should have been when he was clearly very unwell. I had correspondence with the owners of the care home group, and they were really good. They did respond, and they upheld the majority of the complaints. A significant action plan was put in place. We did meet initially with the care home manager, and she was not there at that week when Dad was in. I believe if she was there, we would have got in, which is something I would have wanted to say. 3 members of nursing staff were put on performance management. They were not referred to the NMC. I was given the option that I could have referred them, but I chose not to because, you know, I didn't know what was going on in there, and I didn't know what level of training they needed, so that I was happy with what that when it went there, and that was the end of that. I went to the care inspector because there was some things I still wasn't happy about. Some, if only they had read the Getting to Know Me, if only they had read was, and I says, well, that was an extra, that was an add-on. You know, you should have had all that information in your assessment. And the care inspector really said that they were planning to do an unannounced visit. They wouldn't be taking my complaint, our complaint forward, but they did liaise a wee bit between us and management to get some further questions answered, and that's when we found out about the performance management and the 3 members of staff been under that, which was reassuring.
Did you think the care inspectorate response to you was adequate?
I suppose I don't really know what I expected. I suppose when you're making a complaint, you're highly emotional and angry. So when I reflect back now, probably they wouldn't have done any more. You know, I think they said they were working at home, they weren't going in, they had planned an unannounced visit. I'd have probably liked some feedback to say, well, what did you find in your unannounced visit? But I never ever really went back and looked to see if that was published. Because obviously I was concerned there's other people in there whose families can't see them. But that was an end to that. And then, so I was happy with the response from the nursing home group. I think they handled the complaint really well.
You say it's 72, and I think you've already said this, that if you hadn't taken your dad out of the nursing home when you did, he would have died earlier.
I believe so, yeah. I really do. He was so ill when we had him home. And the fact he was in an ambulance 4 hours after coming home says that he needed hospital care, you know, and he got immediate intervention which was needed. At
paragraph 80, you say the biggest thing for families was not being able to see their loved ones.
Yeah. I think when I was on the front door, initially back at the start of the pandemic, the 4 months I was there, you know, our role there, the staff weren't allowed to enter the front door, they had to go through the back, so it was really to reduce the footfall, and you were seeing families at that door who were dropping things off for their family members. And I would be saying, look, if your mum's got a diagnosis of dementia, if she's distressed, you know, you are an essential visitor, you know. And I would, you know, I'd make judgment calls at the front door if somebody was going in and they had a hearing impairment. You would let the daughter go with them to understand their appointments. But a lot of people didn't know about essential visiting, and I think for me the biggest thing, we should have went in. In hindsight, I should have told them to get out the road and let me walk past them, but you were following these rules. Many of my colleagues are still traumatised. You know, some of my colleagues worked in ICU and nursing staff, and the fact that families couldn't be there a lot of the time was really distressing, and it does haunt a lot of people, you know, because what was the risk? You know, the risk, we can understand that nobody knew what it was at the start, but the best person to be there for families, for patients and residents, would have been their families at times to advocate for them. We knew him and we knew what he looked like, and when we saw him, that was a different man in a week.
When you're on the front door, did you tell people about essential visits?
I did, yes. It wasn't just because we were seeing people at the front door. We were triaging for patients who were going to attend accident emergencies. So you may have under 16s, you maybe have people with mental health conditions or people with learning disabilities. These were people who could have had an essential visitor, and we made that judgment call at the front door, and often people could go with them. if someone was dying in a ward, families would come up and we would get them to the day that they needed to be, if it was palliative care. But I think for dementia, because I suppose many people in nursing homes would have a diagnosis of dementia that's going to continue as normal. So I can understand where the worries and the fears that people would come in. One of the biggest challenges we had at the front door was patients going out for cigarettes, and that would be one of the most frustrating things, because the nurses didn't know in the ward. Somebody would just nip out and go for a cigarette, meet their family in the car park, and you had somebody over there crying because their wife of 80 years old with dementia was in a ward and you couldn't see them. And despite our best efforts, we could not stop some people going out for a cigarette. You know, you'd be get verbal abuse at that door when we'd say you need to get back to the ward, because these people at times were coming in and out. So frustrating.
Okay, I'm almost finished.
Yeah.
But I'd like you to read paragraph 84. It's only 2 sentences.
Mm-hmm. Well, our dad was a good dad. Mm-hmm. He was a gentleman. He still knew who we all were. It was really sad that Dad went through the trauma that he experienced, and that was his ending, the ending he had. It was just awful.
Those are all my questions.
Okay.
Is there anything else that's important that you think we haven't covered?
No, I think that's it.
Thank you very much.
Thank you.
I don't have any further questions. Now we just need to check that Lord Brailsford is there.
Yeah, I'm still there. Thank you very much, Mrs. Bartlett. Very grateful. Sorry I was blanked out for some reason, some technological reason towards the end.
Blessed
Right. Now, Mr. Casket,
I'll see you in the morning, sir.
Or was it Mr. Good? Very good. Thank you. Bye.